Okay, here are the two kidneys and the suprarenal glands. This is the left kidney, surrounded by its capsule, and this is the region of its hilum, and also the sinus of the kidney. The hilum is at the entrance of the blood vessels in the ureter and their exit. The sinus refers to this region in general. Above the kidney there is the suprarenal or adrenal gland. The same on the right side, but here we have a dissected kidney to view its internal composition or internal structure. So, of course, the outer part of the kidney is the cortex, and the inner one is the medulla. In the medulla we have the medullary pyramids or renal pyramids with their bases facing laterally and their apices facing medially towards the hilum. At the tip of the apex of each pyramid you have a papilla. As you can see, these two papillae, their renal pyramids have been removed, but their papilla have been retained. From the papilla you have the minor calyces. So this is a minor calyx. This is another one. Okay. This is a minor calyx. This is another, and so on. The minor calyces join to form the major calyces. Okay? So for example, here is a major calyx, and similarly, yes, the others are not really visible. So the major calyces form the renal pelvis. The major calyces form the renal pelvis, and from the renal pelvis you have the ureter. This is the right ureter, and the same on the left ureter. So this is the renal pelvis here. Okay. Regarding the blood supply, of course they are supplied by the renal arteries. Here we can see the right renal artery divided into lobar branches. These are lobar branches. These lobar branches give rise to interlobar branches, as you can see, until they get to the base of the pyramids where they form the arcuate arteries. These are the interlobar, then you have arcuate. From the arcuate you have interlobular. You can say this is an interlobular artery. If you get it closer a little bit, this is one, this is another, and so on. From the arcuate arteries you have the interlobular arteries. And regarding the venous drainage, this is the renal vein. Of course, the left one is longer. Embryologically, it's formed by anastomosis of the two subcardinal veins, and of course, logically, the inferior vena cava is located on the right, so it has to be longer. And you can see that along with the renal vein, it also receives the suprarenal vein, the branch from the suprarenal gland. One of its veins draining it go directly into the left renal vein. On the right side, it goes directly into the inferior vena cava. And by the way, from the pyramids, you have these medullary rays, okay? These lines. And we can also see another vein here. This is the gonadal vein, going with the ureter, okay? And this is the gonadal artery. And meaning it's either testicular or ovarian, depending on the gender. And here this is the right gonadal artery and right gonadal vein. Some other structures that we didn't take in this lecture, but as far as I can remember, this is the psoas muscle. Okay, this is also important, and it is supplied by the lumbar plexus. Okay, this is the iliacus muscle, and it's supplied by the femoral nerve, branch of the lumbar plexus. They are both going to the lesser trochanter, I believe. Yes, lesser trochanter of the femur. Back here we also have, I think this is quadratus lumborum. It's also supplied by the lumbar plexus. And this is the aponeurosis of origin of the transversus abdominis. Okay? Here this is the diaphragm, the muscular ingrowth, and the central tendon. This is the hiatus of the aorta. This is the celiac trunk. And an interesting observation. This is the superior mesenteric artery, and the left renal vein passes in front of the aorta directly beneath the superior mesenteric artery, the origin of it. And here is the origin of the inferior mesenteric artery at about the level of L3. This is celiac truncus T12, directly at the hiatus. This is L1. And the renal arteries are supposed to be at L2, then the gonadal between L2 and L3, and this is L3. Okay.